So, for the treatment of measles, there's no specific antiviral treatment. What is suggested to be done is to take care of those infections, such as ear infections. Make sure that you get those antibiotics so that that doesn't get worse. You should also make sure that the person suffering from measles is replacing their fluids that are lost from vomiting, as well as diarrhea, and making sure that they have proper nutrition so that there's no more severe complications. Children in developing countries with measles should also make sure that they get 2 doses of vitamin A supplements. So there's a post-exposure vaccine or vaccination. So after you've already been exposed, somebody who's not been immunized, especially infants, can be given that vaccine within 20 or 72 hours of exposure. And this will protect against that measles disease. If it still develops, then the illness will probably have milder symptoms and last for a shorter amount of time. There's also an option to do the immune serum globulin. This would be for pregnant women and infants who have, as well as probably the elderly, those who have a weakened immune system that are exposed to the virus. They can get these proteins or antibodies injected, and it's called that immune serum globulin. This is from the Mayo Clinic, and when it's given within 6 days of exposure, they can prevent measles, and they can also make the symptoms less severe. For prevention and control, isolation is the first step. For someone who doesn't have measles, measles is highly contagious, and it's about 4 days before to 4 days after that rash breaks out that people are the most contagious. People with measles shouldn't go back to their activities, such as school or sports or things like that, where they're interacting with other people, especially these 4 days before and 4 after. It could be also necessary to keep the non-immunized people, such as their siblings, or anybody that lives in the home with them, to stay away from that infected person, because measles is so contagious. We need to make sure that we vaccinate. Someone who is at risk for getting the measles and hasn't been fully vaccinated must get the vaccine as soon as possible. They need to be vaccinated as well as any infant that's over 6 months old. We also want to promote the herd immunity. So since the measles vaccine has happened, it's been pretty much eliminated. Herd immunity basically means that if everyone around you has kind of been vaccinated, they're not likely to get it, so you're also not likely to get it. So if everyone else has, not everyone's been vaccinated, it's not very likely that you will, need that vaccine. However, the vaccine is still highly suggested. The vaccine that is given is called MMR. This is the measles, mumps, and rubella vaccine. And this comes from the Enders Edmondson strain, and it's given in 2 doses. The first dose would be given by the child's first birthday, and the second dose would be given between 15 months and 12 years. So this MMR vaccine is called a live attenuated viral vaccine, an LAV vaccine. And basically this type of vaccine is a weakened version of the virus. So they take the virus and they basically dilute it, and then they'll inject it into the patients, and their bodies will be able to fight that disease, and they won't hopefully get measles.